Let me tell about co-infection, HIV and HCV situation in Russia. During recent year, in Russia, there is a significant reduction in the incidence of acute hepatitis C and a gradual increase in the incidence of chronic Hep C. Since the beginning of the century, the incidence has increased by 3 times and amount to 40%. This slide shows the trends in the incidence of chronic hepatitis B and C. The most complete systematic information about the completeness of patient surveys is available in the Reference Center of Monitoring of Viral Hepatitis of Rospotrebnadzor, where this information is collected from the regions of Russia. Thus, the viral load was determined in 34%, the genotypes 22%, and stage of fibrosis in 40%. This slide speaks for itself. Even the official statistics recognizes the magnitude of viral hepatitis C problem in regard to society and health. Estimated number of anti-HCV positive cases about 6 million. Estimated number of chronic hepatitis C about 5 million people. According to the collecting data, we have a general idea of the distribution of hepatitis HCV in Russia in territory of Russian Federation. This slide presents this distribution. The dominant genotypes are 1B, 3A, and 2A. Genotypes 1A and mixed amount is limited to only 5% of the population with HCV. As you can see, among registry patients, mild forms of liver fibrosis dominate, and only 20% fibrosis stage 3 and 4 is observed. For treatment monitoring, we use a modern diagnostic armamentarium, laboratory data, biopsy, fibroscan. If we talk about the treatment of chronic Hep C, it should be noted that the proportion of patients who received therapy remains small, less than 1% in 2013. However, by 2015, coverage of patients with treatment for HCV gradually increases. This can be judged by the information on patients, including in the National Register, and we see that up 3% of patients are treated. This is because of several reasons. There is federal funding, there are regional programs for the treatment for viral Hep C, treatment regimens without interferon become widely available, and so on. Since before 2030, were the main regimens of treatment with interferon. About the completeness and efficiency, we can say, analyzing this experience. In most patients, the treatment was plain completed. In 13% of cases, the treatment was interrupted due to poor adherence or occurrence of serious adverse events. I would like to note the good treatment results which have been obtained in the treatment of patients with HCV. Naturally, SVR reached 70–80% of patients with genotypes 2 and 3, and in about half of patients with genotype 1. As I said, the incidence of Hep C in Russia remains high. The slide shows dynamics of the number of reported new cases of chronic Hep C in the past 3 years, as well as shows the most affected region in the Russian Federation. Such region includes the Northwest Federal District in general and St. Petersburg in particular. The slide shows the incidence of acute and chronic Hep C in the Northwest District and Russia compared with past 15 years. This, you can see well how the incidence of chronic Hep C in St. Petersburg, as in single megacity, exceeded the same index in the region and Russia as whole, which is associated with various reasons. Now, a few words about the HIV infection and co-infection with Hep C in Russia. If we talk about molecular epidemiology of HIV infection in Russia, it must be said that subtype A dominated in most region. However, it should be noted that for 20 years there were some changes in the distribution of HIV subtypes in Russia, with the advent of new subtypes, changes in their ratio. As you can see, the overall epidemiological situation with HIV infection in Russia remains complicated. In 2015, there was an increase in HIV new cases by 4%. Altogether, more than 200,000 new cases have been reported. The total number of infected people has exceeded 1 million. A growing number of Hep C and B infection is also observed. The total number has exceeded 272,000. Antiretroviral therapy receive more than 200,000 patients, which unfortunately is about 30% of all patient dispensary. Thus, we are witnessing of how the co-infection epidemic is spreading, HIV combined with viral Hep C and B, especially C. You can see from the example of the St. Petersburg AIDS Center, the maintained high prevalence of co-infection, which reached 76% in 2014. Over the last 2 years, due to the predominance of HIV sexual transmission, the number of these patients started decreasing. According to the report in forms of the regional AIDS centers, there is a gradual decrease of the number of patients newly diagnosed with HIV combined with chronic Hep C and B compared to the absolute prevalence of co-infection in the early 2000s to 33%. Naturally, along with the increasing number of co-infected patients, the number of diseases due to end-stage liver cirrhosis and hepatocellular carcinoma is also growing up. I would like to return to the question of the distribution of genotype C among patients in Russia. It must be emphasized that genotype 1b is found in 15%, but in early, this genotype is in general was predominant in the general population. In some region, frequency of its detection is limited of 90%. A proportion of subtype A is 35%. This subtype dominated previously in co-infection with HIV. For comparison, this slide provides an analysis of how genotypes Hep C virus are spread and stage of liver fibrosis in patients co-infected with HIV/HCV in St. Petersburg. Similar distribution is still present. Half of genotypes belong to 1b. In other cases, genotypes 3 and 2 are represented. It's likely these trends are linked in the penetration of HIV from high-risk groups to the general population and the gradual mixing of genotypes of Hep C virus. Certainly, this will affect the nature and the effectiveness of antiviral therapy for Hep C. The slide shows the data of St. Petersburg AIDS Center, where several years I have been coordinating treatment of outpatients. It shows the number of patients received therapy and how to choose an approach to treatment of co-infected patients. Various therapeutic modalities, from watching and waiting to using direct-acting antiviral drugs, latest generation, are in existence. In any case, it is up to a doctor and hospital to decide to what extent it is possible to follow the guidelines and prescribe treatment. For example, in the St. Petersburg AIDS Center, there are about 1,000 patients in the waiting list of treatment initiation. And in the end of my report, I would like to say that there is serious problem in Russia connected with co-infection, HIV and HCV. But we are on the right way to solve it, and this approach brings positive result already. Thank you for your attention.